welcome to Caregiver Connection, a monthly series with the Baltimore County Department of Aging Caregiver Support Program. So today we are going to be hosting SHIP, which is the State Health Insurance Assistance Program. We have one of our wonderful volunteers from SHIP, Fred, who will be going through and discussing with us a little bit more about the upcoming open enrollment period through Medicare and how we can kind of navigate that. So before I hand it over to Fred, I just wanted to share a little bit of information. So first, just a heads up, a reminder that this is going to be recorded today. So if you have any questions, you can place them in the chat or raise your hand, and we will get to those after the presentation. And then just a reminder as well that the Caregiver Connection series is moving to the third Thursday of each month at 1 p.m. and that will be on Zoom. If you want access to that link, you can contact us or go on our website to get that each month. It's going to be just a space where we can get together, share our thoughts, share resources, and really just join together as caregivers to see how we can support each other. And so this is our contact information. You can see our phone number and our email address up at the top there. And then a few other ways you can find us online as well, including our website and the YouTube channel for the Baltimore County Department of Aging, where we have some of our previous recordings uploaded. And in addition to that, you can find us on Facebook with the Department of Aging, and then the True Alta program registration link is there as well. If you have any questions about any of this, you can contact us. But for now, I am going to hand it over to Fred so that he can talk with us today about open enrollment.
So I'm going to start out with some terminology, get some things out of the way, because I'm going to refer to them in the presentation. I am going to go not really too deep into them, but hopefully you're already familiar with some of these. And so we're going to go over a few basic health insurance terms and talk about some Medicare terminology. Then we'll talk about the times when you can enroll in Medicare or the parts of Medicare. Then specifically get into open enrollment, talk about healthcare housekeeping, things you should keep or pay attention to, how you would choose or change a Part D plan, give you a brief demo of the drug plan finder that's on Medicare.gov, how you would choose or change a Medicare Advantage plan, and finally, sources of help and information. First of all, my hat's off to all of you out there who are caregivers. What a tremendous task you've undertaken, and what a kindness you're showing to the person that you're taking care of. And if I can help in any little way through the information today, it will certainly meet my expectations. So let's start with some terms. And the first term is premium. And a premium is the monthly amount that you pay in order to belong to an insurance plan. So this is the same as the premium that you pay for auto insurance or homeowners insurance or life insurance. So it's like the entry fee. In 2026, monthly Part B premiums, are $206.50 a month, and the Part D, as in dog premiums, are $6 to $108. The next term is deductible. That's what you have to pay for your treatment or drugs before the insurance coverage begins. You may be familiar with the term deductible from your car insurance or homeowners insurance. So if you have an accident and you are using your car insurance, you have a $500 deductible, you have to pay that deductible before the insurance kicks in. And there are deductibles for all the different parts of Medicare. Finally, a copay amount. Copay is the portion of the cost that you have to pay for services or prescription drugs. So for example, if the list price of a drug is $20 and the insurance plan pays $18, your copay is $2. So for prescription drugs, basically what you're paying at the pharmacy is usually a copay. Note, you normally have to meet your deductibles before the copays actually kick in. Now I'm going to shift into some Medicare terms. So there's two types of Medicare. The first is what we call original Medicare. This is the historic Medicare, which most people still have. It goes back to the 1960s, I believe 1965, when the Act of Congress and the President created original Medicare. And for people with original Medicare, there are three parts to it. Part A is the part that covers hospital stays, also covers rehab stays in a nursing facility and hospice care. Part B is the part that probably affects caregivers most. Most outpatient services are covered under Part B. That would include visits to primary care doctors or specialists, blood tests, medical equipment, MRIs. Also, therapy is covered under Part B. So that could be physical therapy in the home, or could be the visit by a nurse. And then Medicare Part D is the portion that covers prescription drugs. Parts A and B come directly from the government, the Centers for Medicare and Medicaid Services. Part D is actually through an insurance company. The other type of Medicare is Medicare Advantage. So Medicare Advantage is an alternative to original Medicare, which is delivered by private insurance companies. It includes the health coverage and drug coverage in a single plan, and it includes other benefits not normally offered by Medicare, such as dental and vision, transportation, stipends for over-the-counter drugs, and even stipends for household purchases. Most of these are still HMOs, which means you have to go to doctors and hospitals that are in their network. Medicare Advantage delivers the same services as original Medicare. They're just maybe delivered in a different fashion. The copays and deductibles are often different. And finally, sort of something we won't get into much in this talk, but there is a product called a Medicare supplement, also known as a Medigap. This is an insurance plan that covers some or all of the deductibles and copays that are associated with parts A and B. So it goes only with original Medicare. And these plans are identified by the letters A through N, which makes it rather confusing. Most people get Plan G or Plan N. And Plan G provides the most comprehensive coverage, but it's also the most expensive. And these plans, unlike the Medicare Advantage, these plans are accepted wherever Medicare is accepted. So some basic rules. If you have original Medicare, you must have a Part D plan for prescription drug coverage. If you don't have drug coverage, then there's a penalty when you do finally get it. If you have Medicare Advantage, then the drug coverage is included. Can't have Part D with Medicare Advantage. And you can't have a Medicare supplement or Medigap and Medicare Advantage. You have to take one or the other. And there are often penalties for failing to enroll in Medicare when you turn 65. unless you're still working or your employer provides insurance. All right, so that's sort of the preliminary stuff. Hopefully, some of that sounds familiar. Hopefully, it all makes sense. If not, again, I welcome the opportunity to talk with you in person in more detail. So let's talk about enrollment periods. So the first enrollment period is what they call the initial enrollment period. This occurs when you turn 65. And the 3 months before your 65th birthday, the 3 months after your 65th birthday, and the month of your birthday are all part of that initial enrollment period. That would be the time when you would enroll in Medicare if you don't have any other coverage. People who are on Medicaid and turn 65, the vast majority of those people will need to sign up for Medicare. The second type of period, one that has become more and more familiar to people, is called a special enrollment period. And that's when your coverage from another source of health insurance ends for some reason, usually retirement. And you get this special time to be able to enroll. So if you're working past 65, you're covered by your employer, you don't really have to sign up for Medicare until you retire. And then you get what's called a special enrollment period. Then what we're focusing on today is the open enrollment period. That's an annual period from October 15th to December 7th, when you can change from one Part D or one Medicare Advantage plan to another, or sign up for the first time if you missed other periods. And whatever you sign up for becomes effective January 1st of the upcoming year. So why is this open enrollment period so important? Well, first of all, this is the only time when you can initially enroll or change plans beyond that special enrollment period or the initial enrollment period. So anyone who missed enrolling in a Part D plan during their initial enrollment period or their special enrollment period can only enroll during this time. Let's take an example. You've gone through your initial enrollment period. You sign up for Medicare A and B, and nobody told you that you needed to sign up for Medicare D. Well, you realize that A and B don't cover prescription drugs, and now you want to sign up for D, but you're no longer in the initial enrollment period. Well, the only time you can sign up for D is during this open enrollment period then. So in some cases, people have to wait a few months. They can't get prescription coverage if they missed it during their open enrollment period or their initial enrollment period or their special enrollment. The second reason why it's important is for most people, this is the only time when they can make a change in their plans. So if you have a drug plan and during the course of the year, something changes and you would like to get a new drug plan, you're not able to do that then. You have to wait until this open enrollment period. So people that have had a change, this can become in prescriptions or change in their life condition, this can become very important. If you already have a plan and you don't make a change, you automatically get enrolled in the same plan or a comparable one. So I currently have a Part D plan called WellCare Value Script. If I don't do anything during the open enrollment period, I am going to get WellCare Value Script next year. Last year, many people had a Aetna Silver Script plan. Aetna made changes to their plans and eliminated 2 of them. Everybody that had Silver Script ended up with a new plan because Aetna moved them all into that plan. So many people had a plan that cost $17 and they ended up with a new plan that cost $47, much to some people's chagrin. So another reason why open enrollment is important is that these Part D plans and Medicare Advantage plans do change every year. For example, some of these plans get eliminated or they change their premiums and benefits every year. If you're not keeping track of it, you might end up having a change in that premium or benefits that may not work to your advantage. I sort of alluded to this just a second ago. If an insurer eliminates a plan, they will put you into whatever they call a comparable plan, regardless of the premium or benefits. We had a situation, I think it was a few years ago, might have been a Humana plan. People were in a $35 Humana plan, ended up in a $75 Humana plan. So this is really important that people pay attention to this. If you don't check into this and don't make the change during open enrollment, you might get stuck. You also may need to change if your life changes. For example, all of us over 65, myself included, know that we can go to see our doctor one day and find out that something really maybe not so good has happened. So if you develop a new health condition that may not be covered very well by your Part D or your Medicare Advantage plan, you may need to make a change during open enrollment. You may experience a family change, such as the death of a spouse. The death of a spouse, in some cases, can drastically affect the financial condition of a family. So you may need to make a change during open enrollment because maybe you're in a plan that you can't afford anymore. Or you may need to make a change because your residence changes. You may move from one county to another and one state to another, move into an assisted living or care facility, and you might have to make a change to your Part D or Medicare Advantage plan. So what can you change during open enrollment? Well, as far as Part D is concerned, the prescription drug plan, during open enrollment, you can change from one Part D plan to another Part D plan. Or if you missed an enrollment period, you can enroll in Part D for the first time. If you have Medicare Advantage during open enrollment, you can change from one Medicare Advantage plan to a different one. Or you can change from Medicare Advantage to original Medicare, or you can change from original Medicare to Medicare Advantage. What you can't change during open enrollment. You can't initially enroll in Medicare Part B. So if you aren't in the initial enrollment period and you don't get a special enrollment period, you can't enroll in Part B during open enrollment. There's a different time of the year to do that. You can't change your Medicare supplement during open enrollment. Actually, you can change it, but open enrollment really doesn't apply to Medicare supplements. There are different rules for that. If you have some addition to your Medicare, like a retiree plan, like maybe the state of Maryland and retirees have, you can make a change to that, but they usually have their own open enrollment. And then maybe you might have some additional non-Medicare plans, such as separate dental plans, they too may have their own open enrollment. What happens if you do nothing? You don't make any change during open enrollment? Well, one of these things could happen. Your Part D or your Medicare Advantage plan could stay the same, which is kind of what we might hope. Or it might automatically change to another plan if the company eliminates your plan and the company selects a new plan for you. I already mentioned about Aetna's Silver Script. Last year, Aetna also made some changes to their Medicare Advantage plans, and some of them also disappeared. And people needed to pick a new plan. If they didn't pick a new plan during open enrollment, then I have no idea what might have happened. If the company exits Medicare in a particular state or county, a person could lose their drug plan and lose their Medicare Advantage plan. And if they fail to sign up for a new one, they're kind of out of that. They may be stuck without a drug plan. They miss changing a Medicare Advantage plan, they go back to original Medicare. If you don't change anything during open enrollment, the benefits offered by your Part D or Medicare Advantage plan could change. I've sort of been beating the drum, I guess, a lot on this. Monthly premium could change, the coverage could change, the copays and deductibles could change. So let me talk about, as a caregiver, some things that you might want to pay attention to. They will help you make these decisions. First of all, you probably already know this. You got to take care of the ID cards for the person that you're taking care of. All of these cards are important. The Medicare card, the Medicare Advantage card, if they belong to a Medicare Advantage plan. Part D card, if it's applicable, Medicare supplement card, if it's applicable, dental, vision, or other cards. And if the person you're taking care of insists on keeping the cards yourself, it would be a good idea to maybe scan those or make copies of them. It's good to help the person you're taking care of by helping them keep a list of prescriptions that includes the dosage and the frequency of use, how frequently the drugs are refilled, and what pharmacy they're with. In terms of record keeping, there are lots of notices that Medicare and Medicare companies that provide Medicare services issue. For example, if you belong to original Medicare, you get Medicare summary notices in the mail, or you can get them in email, or you can download them. It's good to keep them. I've seen cases where people call us up and there's an issue with a service that was delivered even as long as a year ago, and the person may have trouble finding records of what actually happened then. So if you get these notices, it's a good idea to hold on to them, at least for a year or two, in case anything comes up. You may also want to hang on to the monthly updates from the Part D plan. Usually the current month totals everything up, so you may only need to keep the current month, but wouldn't hurt to keep everything. Other documents such as reports from Medigap plans, dental plans, and so forth are helpful. We strongly encourage people to set up a Medicare.gov account. This is an account with the person's username and a password that gives them access to all the information that Medicare has about them. And if you set this up for the person that you take care of, it can really be helpful in terms of just some of the things I've already talked about. So this Medicare.gov account keeps track of all the prescription drugs the person uses. It provides copies of those Medicare summary notices. It provides the name of the Part D or Medicare Advantage plan. You know, I have people call up and ask them what Part D plan they have. Well, it's WellCare. No, I had that 2 years ago. So people sometimes can't remember what it is. You can log on to this one account and see it. You can use this to print a duplicate Medicare card. You know, a nice thing to have. And it simplifies the process of picking out a drug plan using the drug plan finder. This is what Medicare.gov looks like. And if you have a Medicare.gov account, you would want to go to that selection on the far left side, which says log in or create an account. That's where you can set one up. Here are just some slides from my Medicare.gov account. It shows my drug plan here. It shows the other plan that I have. It shows that I do not have something called extra help. It shows a list of pharmacies I may go to. And then it shows a list of drugs that I take. Well, I actually threw some drugs in here just to help me in picking a plan. It shows the latest visits to doctors and gives you a chance up here in the corner to download Medicare summary notices. If you have a Medicare Advantage plan, the Medicare Advantage plan has a portal that is very much like what I just showed you for Medicare.gov. And you can do most of the same things that I mentioned on that Medicare Advantage plan portal. Again, this is a way for you to help manage the health insurance for the person that you're taking care of. So how do you enroll in or change your Part D plan or your Medicare Advantage plan during open enrollment? Well, there are 4 ways. One is to do it yourself, and I wouldn't discourage that if you feel comfortable using the computer. You can get onto Medicare.gov, and if you want, we have some instruction sheets that we could send out to you. You could also call us. We get a lot of people calling us during open enrollment. We try to help as many as we can. We also go out to the senior centers and meet people who have made appointments to see us then. We never turn anybody away, except if you call the day before open enrollment ends. So earlier, the better. You could also call Medicare directly at 1-800-Medicare. It's also a busy time for them, but you can call them and enroll a plan. There are also insurance brokers out there who will help you select a Part D or Medicare Advantage plan. I will mention they get some compensation from some of the Medicare Advantage or Medicare Part D plans. When you pick the Part D plan, you want to find a plan that covers all or most of your prescriptions at a pharmacy that meets your needs at the lowest possible cost. The cost consists of these items for Part D: the monthly premium, the deductible, and the copay amounts. So for an example of a total cost, if somebody signed up for a plan with a monthly premium of $20 with a $500 deductible and some copays after they meet the deductible, the total cost consists of the 12 months of premiums, the deductible, and what all the copays are going to be throughout the year. We use something called the Plan Finder to find the total cost of a Part D plan. You can access that on the Medicare.gov site by clicking on the thing that says Find Health or Drug Plans. Let's skip through this. Picking a Medicare Advantage plan, you want to find a plan that covers the doctors and hospitals that you use. that provides the additional services that you want, has reasonable copays for services, and does that at a desirable premium. Types of Medicare Advantage plans are HMOs. This is what most of them are. That's where you have to go to doctors and hospitals in network. PPOs, which allow you to go outside of network, but you do pay a higher fee than if you stay in network. And special needs plans for people who are dual Medicare and Medicaid, or have certain chronic illnesses, or live in a nursing home. We create something called a Medicare Advantage chart, and it shows all of the categories for each Medicare Advantage plan. These are some of the things we look at or help people to look at: what the monthly premium is, what the deductibles are, what you pay if you go to a primary doctor, whether referrals are needed, what you pay when you go in the hospital, what you pay with an ambulance, what you pay for lab services, X-rays, MRIs. Does it include dental benefits, eyeglass benefits? What do you pay if you get durable medical equipment? And what are some of the supplemental benefits that are included? In this case, maybe chiropractic, acupuncture, fitness, transportation, over-the-counter drugs, and so forth. Maybe the most important thing in selecting a Medicare Advantage plan is what hospitals, in a sense, the doctors associated with those hospitals, which are covered by this particular plan. So for Care First Advantage PPO, it covers University of Maryland, MedStar, LifeBridge, Mercy, and Ascension St. Agnes. They do not cover Johns Hopkins. So one thing I like to point out to people, if you need to see somebody at Johns Hopkins in the PPO plan, you're going to pay more for it. If you're in an HMO plan and they don't cover Johns Hopkins, you'd have to pay the full price. Some frequently asked questions. Should I reevaluate my Part D plan or Medicare Advantage plan each fall during open enrollment? Absolutely. Either reevaluate it on your own or make an appointment with SHIP to review it every fall. Why? Because the insurance companies may eliminate the plan and merge it with a higher cost plan. They may remove one or more of the drugs from their formulary, which is the drugs they cover. They could change the deductibles. In some cases, Medicare has even removed a company from the list of approved plans. If you unexpectedly have to take a higher cost drug, the only time you can change from one plan to another is during open enrollment. And some of the factors affecting the cost of the drug include something called a tier, the dosage of the drugs, the pharmacy that you go to, and what the drug plan is. All these are things that the drug plan finder takes into account that we also could help the person to understand if we are counseling them. Finally, here is some helpful information which I can share with Nicole, as well as these slides, and she can send them out to you. So that kind of covers my what I was going to talk about. Stop sharing stuff.
Thank you so much. That was so thorough, and like that was really great. I really appreciate that.
I probably went through it too fast, but to try and get it all in a half hour is a challenge.
Well, I think it was very thorough. I appreciate that. One question. So you had mentioned at one point, you mentioned a program called Extra Help. So if somebody isn't sure if they qualify for extra help or things like the state prescription drug assistance program, those kind of things, is that something SHIP can help them with to figure out if they qualify and how to apply and everything like that?
So since I was running late, I kind of skipped over that, but
That's okay.
Okay, so the next slide.
Oh, perfect. Look at that. You're ready.
So there are some programs, and everybody doesn't know about these. And I have found cases where we're talking to somebody, they just call for information about something, and we may say, what's your what's the person you're taking care of? What's their income? And so what are these programs that can assist people? Well, there's something called QMB that pays the Medicare premium for Part B. It also eliminates deductibles and co-pays. It's administered by the state of Maryland, so application is through them. There's a program called SLMB that doesn't cover quite as much. It pays only the Medicare premium, but that is $185 a month, $206 in next year. So that's not insignificant. That also is administered by the state. So QMB and SLMB basically apply to Medicare Parts A and B. There's something called Extra Help that helps with prescription drugs, whether you use them under Medicare Advantage or through a Part D plan. So Extra Help pays some or all of the Part D premium or the Medicare Advantage premium. It eliminates deductibles and it lowers the copays. It's administered through Social Security, so the application is through them. And then finally, there is the Maryland Senior Prescription Drug Assistance Program, and we also call that Maryland SBDAP. That pays $75 toward the cost of a Part D premium. So if you have a prescription drug plan and the premium is $50 a month, you're going to have your Part D plan paid completely by this Maryland SBDAP. It's administered by the state, although it's through a different agency than the QMB and SLMB. Here are the income and asset limits. I just did them on an annual basis, although I have to say most of the time we talk about weekly basis. For QMB, your income can't be above $15,900 for a single person or $21,396 for a married person. Assets can't exceed $9,660 for a single person or $14,470 for a married person. Assets do not include a house or a car. What they do include is savings accounts, checking accounts, CDs, stocks, bonds, mutual funds, 401ks, or rental properties. For the SLMB, which is sort of covers part of what QMB does, it's the Part B premium. Income can't be above $21,372 for a single, $28,800 for married. Assets can't exceed $9,660 again for a single, or $14,470 for married. For the Extra Help program, $23,712 for single, $31,968 for married. Those are the income limits. The asset limits are a bit higher than QMB and SLMB. $17,600 for single, $35,130 for married. The SPDAP only has an income limit. So you're a single person, about $47,000 a year, a married person, $63,000 a year. They don't look at assets at all. So I like to tell people you could have a 401k plan with $1 million in it and you'd still be able to qualify for this. For QMB, SLMB, and SPDAP, what we do at SHIP is we mail or email the application to somebody and they need to fill it in and take it to the appropriate state agency. For Extra Help, you can actually apply for this online at the Social Security website, or we at SHIP will apply for you. And things do go much faster if you go online. I covered that in case, I included that in case somebody asked.
Yes, thank you. You were prepared. The only other question we had was in reference to the upcoming open enrollment period as far as being able to schedule an appointment with a SHIP counselor. So I do have the flyer for that scheduling. So I'm going to actually share that real quick. Let's see. Let's see. And I will actually send this flyer to everyone as well, just so you have it for your own reference. But that shows some of those upcoming dates where some of the SHIP counselors are going to be in some of the senior centers, as well as just some info on how to make an appointment, and then some info on what to bring to the appointment, which can be helpful too. So I will include this when I send some follow-up info to everyone after the presentation today. So I'll leave this up for a minute. And then if anyone has any other questions, let me just check the chat again. Let's see. All right, I don't see any more in the chat. All right, I'm gonna stop sharing my screen. And then I'm just gonna throw in the chat the contact information for the caregiver support program as well, just in case there's anyone on that doesn't have that already that has any questions. And then let me just throw that in the chat room. All right. And then, yeah, Fred, if you want to share those slides with me, and then I can send that to everybody who participated today, so they have that for reference. We also recorded today's presentation, so once that is ready, we will send that out if you need it for reference later. And of course, if you have any questions, Fred has his contact info in that presentation, and I put the caregiver support programs in the chat as well. Otherwise, we will go ahead and wrap up. I appreciate everybody joining today, and I especially appreciate your extremely informative presentation, Fred. That was very helpful. I really appreciate it. Thanks, everybody.